Hi friends, I am Dr. Toishi Sharma, Interventional Cardiologist, and since it is winter time, today we will talk about what precautions we should take during the winter time, especially for your heart. Number 1. Dress warm. During the cold winter, our arteries undergo vasoconstriction, which is like a vasospasm. When this happens, the blood pressure suddenly rises. When the blood pressure rises, you can imagine the heart has to work against an increased amount of pressure, and this is called increased afterload for the heart. When there is increased afterload for the heart, then it poses a greater risk of hypertensive urgency, emergency, and even the rupture of a plaque if you have any blockage in your heart. And rupture of a plaque can cause a heart attack. Therefore, especially if you are a heart patient, then you should make sure you're dressing in multiple layers and avoiding any change in extreme temperature. If you are going outside, make sure you are dressed in warm layers because the cold-induced vasoconstriction will increase your myocardial oxygen demand. Number 2, check your blood pressure every single day. Usually when people have a controlled blood pressure during the summer months or the springtime, when winter strikes again because of vasoconstriction, the blood pressure tends to go up. And this is one of the reasons that we also see an increase in heart attacks during this time. So what happens is, people assume that because their blood pressure has been well controlled, it's no more important to check it regularly. But it is important to remember that blood pressure is something that can change on a daily basis. And especially in winter time, people are prone to developing high blood pressure. Many times because of this reason, we have to start an additional medication during winter time, and when the summertime hits, we are usually able to de-escalate the antihypertensive medications. So during winter time, it is especially important that you check your blood pressure every day, and if you notice a trend that your blood pressure is going up, you should call your doctor immediately and get your blood pressure rechecked and medications adjusted accordingly. Number 3, in winter time, it is very important to maintain your medication adherence. Winter time is a time where there is increased risk of heart attacks, so you should make sure if you have been prescribed aspirin, beta blocker, blood pressure medications or cholesterol medications, you are taking all of them regularly. If there is going to be bad weather and you may have difficulty getting your medications from the pharmacy due to a storm, make sure you always have a good amount of medications at home and all the refills that you need so that you would not skip even 2 or 3 days. If you have high blood pressure, then skipping a medication, especially during winter time, even for 2 or 3 days, can cause a stroke or heart attack. Another point is preventing respiratory infections or virus infections. In winter time, as we know, many people get sick with cold and flu-like symptoms, but these simple cold and flu can trigger a significant inflammatory response in the body. Especially if you have any blockages, then inflammation is a known factor for rupturing the plaque, which can cause a heart attack. So you should try to stay away from anyone who is sick. Whenever you are going in and outside the house, you should wash your hands properly for at least 20 seconds and make sure that you are wearing masks in crowded places. Also, my friends, winter time is a time when we tend to get lazy. We tend to reduce our workout, our exercise time. But it is even more important in winter time to keep up your activity and eat well, because if you exercise regularly during summer, that actually decreases your blood pressure. And in winter time, as I just explained, your blood pressure already tends to go up because of vasoconstriction. So if you stop exercising in winter time, that will be even more reason for your blood pressure to go up. And that increases the risk of your heart attack or stroke. So please continue your exercises, and if you haven't been exercising, make sure that you exercise during winter time. Also, because of the season, and we generally tend to feel low mood when there is lack of sunlight, so people tend to eat very unhealthy like fried foods and things like that. So you have to be especially careful during winter time to eat a healthy diet that is high in protein, high in fiber, and low in refined carbohydrates. Finally, my friends, watch out for any symptoms like chest pains, shortness of breath, and also swelling around your ankles in your feet. This could indicate heart failure symptoms that can be very subtle and slow in onset and progression. Make sure during the winter time you are seeing your regular doctor at least once anywhere between October to February so that they can examine you, adjust your medications, and do any additional lab or imaging that may be necessary. So friends, I hope this video was helpful for you. And if you have any questions for me, please do not hesitate to comment. Thank you.